is Phyllisa Deroze, and I am diagnosed with type 2 diabetes. I was diagnosed with type 2 diabetes in 2011. I'm originally from Pompano Beach, Florida. I currently reside in the UAE. I'm a professor of American literature. When I was diagnosed with diabetes, I felt confused, ashamed. I felt like total devastation. I didn't know how this had happened to me, especially being the only person in my immediate family with diabetes. I felt alone when I was first diagnosed. Of the 4 priorities, it's kind of hard for me to pick one because when I was first diagnosed, I didn't know anything about diabetes. I had gone to a physician telling her that I had the classic symptoms, but yet I was misdiagnosed. So diabetes education is very important. Also, given my socioeconomic status and personal upbringing, access to certain medicines and medications and affordable care was also a problem. For example, I went from having 0 medical costs to after diagnosis averaging $300 a month just to maintain my proper diabetes care. So for me, access to care is also important. When it comes to discrimination is also important to me because as a person living with type 2 diabetes, there's so much stigma out there. You've caused it upon yourself. It's because you didn't do something. So there's discrimination there as well. So for me, if I could do anything, I would make them all top priority. It is very important that governments get involved because diabetes is an epidemic and it's affecting so many people. And if you want your citizens to be healthy and happy, you have to get in there and help. It is a shame and an embarrassment that given the healthcare system, especially in the United States of America where I am from, that I would have to spend with the good insurance $300 a month just to manage diabetes. I love traveling. And in my travels, I have noticed that the same strips that I pay $89 in America for, in other countries are $30 or $25. So it is important for governments to get involved and change that. Unite for diabetes.